Now, the organs of the body are all located within their cavities, and the body cavities are really important because they protect, compartmentalise, surround the organs of the body. So the organs of the body can be in a nice logical place, in the right situation, in the right position, so they can perform their appropriate physiological functions. And if we start at the top, we see that the top cavity here is the cranial cavity. So this is the cranial cavity at the top. And the cranial cavity is going to contain the brain, and it's also going to contain the meningeal layers that surround the brain. And it's surrounded by the cranial bones. So the cranial bones surround, define, compartmentalise the cranial cavity. Now, you probably know that the spinal cord is continuous with the brain. So the cavity is also continuous. So what we notice is there's a spinal or vertebral cavity that's projecting down, so the spinal cord can go down this cavity. And this cavity is surrounded by the vertebrae, these backbones, and the spinal cord, which is in the vertebral cavity, can go through these bones, and that means it's protected. And this is why it's so important if we have any injuries to the vertebrae, because if there's any injuries to the vertebrae, then what can happen is, imagine that's the spinal cord. This piece of paper is the spinal cord, and that's going through the vertebrae like that. Now, that's all absolutely fine as long as the vertebrae are intact. But if the vertebrae is damaged, and then we move the patient's neck or we move the patient's back in the wrong way, then it can transect the spinal cord, which is now useless. Now, this turns an injury from the vertebrae, this is a serious injury, into a catastrophic injury. This is terribly serious. I was joking a bit then, but it's really serious. We must be so careful with this, because that means that whatever level the spinal cord is transected at, the patient will not feel or move anything below that level ever again. So we can see already that there's important clinical implications here. And the spinal cord actually stops about there, but the spinal cavity or the vertebral cavity goes on further down, because we have large nerves going down there as well to supply the pelvic organs and the bottom part of the body. So we have this cranial cavity and the vertebral cavity. Now, these are sometimes described as the dorsal body cavities. Now, when we're talking about the body, this is the dorsal surface here at the back, and this is the ventral surface here. Or another way to put it is this is the posterior and this is the anterior. But these are sometimes described as dorsal body cavities, and these are the these are the neurological cavities, because the brain and the spinal cord, of course, are the neurological tissues. So they're the dorsal body cavities. Now, going down, of course, we have the thoracic cavity, which is here, which we've drawn in blue. Now, the thoracic cavity is going to contain the lungs, it's going to contain the heart, the major blood vessels that are associated with the heart. So you might know that leaving the heart we have the aorta and the pulmonary arteries. Well, one pulmonary artery leaves the heart. It quickly divides into two, one going to each lung. We've also got the inferior and superior vena cava, taking blood back to the right side of the heart, and the pulmonary veins, taking blood back to the left side of the heart. So we've got the heart and the lungs there, the major vessels, and also the esophagus, the food pipe, because you swallow food up there, but it's actually used down there in your stomach, so it has to go through the thoracic cavity. So the esophagus, and also the trachea is in the thoracic cavity, which is taking air to the right and left main bronchus to go into the right and left lung. And there's also a rather interesting gland in the thoracic cavity called the thymus gland, which has fascinating immunological functions. So they're within the thoracic cavity, which we've drawn here in blue. So that's the thorax or the thoracic cavity. Comes from the Greek word for chest. Now, going lower down, we have the abdominopelvic cavity. the abdominopelvic cavity. Now I'm just going to trace the outline of this now. So it goes here. This is the diaphragm. The diaphragm is dividing the thoracic cavity from the abdominal cavity. So it's the diaphragm. Then that's the anterior surface of the abdominopelvic cavity going down here, all the way down here, and back up to back up there. So that's the abdominopelvic cavity. It's covering the abdomen and the pelvis, the abdominopelvic cavity. And the reason we call it one cavity, really, anatomically, is it is one cavity. So, for example, if you were pregnant, then the uterus will expand up into the abdominal cavity, as you will clearly remember if you have been in a state of gestation. That the baby will rise up, that the fetus will rise up here as the uterus rises up. Or even indeed if you've got a very full bladder, that can also rise up into the abdominal cavity as well. But medically it's very often useful to think about the abdominal cavity as being separate. So the abdominal cavity is actually this part here. The top part of the abdominal cavity is the inferior surface of the diaphragm, and that's it there, we've drawn in orange. And then the pelvic cavity is the bit below that. So this is the pelvic cavity here in yellow. Now, the abdominal cavity is going to contain the stomach, the liver, the spleen, the gallbladder, the small intestine, most of the colon and the large intestine as well. And further down, the pelvis is going to contain the bladder, as we've said, part of the large intestine, the anus, but also mostly the reproductive organs are going to be in the pelvis. And the pelvis actually is the area of anatomy which is surrounded by the pelvic bone. So you have the pelvic girdle here that surrounds the pelvic cavity. So the pelvic cavity actually goes from about L4, the fourth lumbar vertebrae there, to the anterior rim. So the volume of the pelvis really is described by the bone round about it rather than an individual cavity, because it's continuous with the abdominal cavity. So we see that the cavities aren't cavities at all in life. They're actually filled with the organs. So if you saw the top off my skull, pull out my brain, pull out the vessels in my brain and the meninges, what you'll be left with is the cavity, the hole where those things were. So the cavities are the holes where the organs are actually located. Now, let's look at this from the front now, from an anterior view. And I've started to hatch this one in already. Actually, I think just before we do that, we'll mention we mentioned that these were at the back we had the dorsal cavities, which were the cranial cavity and the spinal cavity. All these at the front are sometimes also referred to as the ventral body cavities or the anterior body cavities at the front. So the ventral cavities are going to be the thoracic cavity and the abdominopelvic cavity, are the ventral or the anterior cavities. Now, as we were looking at this from the front, the anterior view. So here we can see the cranial cavity, as we know, that contains the brain, and there we see the top of the vertebral or spinal cavity. Now, what we have round here is the thoracic cavity, which is going round about here like this. And this is the diaphragm. And the thoracic cavity is protected by the ribs and the intercostal muscles to protect these delicate organs. And it's compartmentalized from the abdominal cavity by the diaphragm, which runs across there. This dome-shaped muscle that compartmentalizes the thoracic cavity above, the superior ventral cavity, and the inferior ventral cavity, which is the abdomino and pelvic cavities. But we notice I've drawn two colours here. So we have in blue, we have these are the lung fields. These are the pleural cavities. the pleural cavities. And these are surrounded by the pleural membranes. And we notice that each lung really is in its own little cavity. Well, not that little, the lungs are quite big. So we have the right pleural cavity and the left pleural cavity there. And this is so important that the lungs are in their own cavity, because if someone comes along with a knife and they stab you in the chest with it, then what's going to happen is air from the outside world is going to get into this cavity and that lung's going to collapse. And that's really serious. But if both lungs collapsed, that would be even more serious. So only one lung will collapse with a penetrating chest injury because the other lung is in its own individual pleural cavity. That's just very, very important. But what I've coloured in red here, in red we have this area here. This is the mediastinum. Now the mediastinum is the bit in the middle. Media is in the middle, so it's in the middle of the chest. So it's going down the middle of the chest there, and it goes from the sternum all the way to the vertebrae at the back. And it's in two parts. The top part, what we're going to call the top part, well, the top part's always called superior, isn't it? So that's the superior mediastinum we've drawn here. And this is going to be the inferior mediastinum here. Now, the inferior mediastinum, in a sense, it's got its own cavity. This is the pericardial cavity. Peri, around about, cardiac, heart. So the pericardial cavity is surrounding the heart, and that's in a tough pericardial membrane, and the heart is inside here. And the superior part of the mediastinum. Now the superior starts where if you feel your chest there, there's a sternal notch in the sternum. That is the sternal notch. And if you go back from there, you come to the junction between the fourth and the fifth thoracic vertebrae. Anything above that is the superior mediastinum. Anything below that is the inferior mediastinum. Now the superior mediastinum contains largely the large blood vessels like the aorta and the superior vena cava. This is why injuries to the centre of the chest are so significant. So if someone has injuries to the centre of the chest, that can damage the large blood vessels or the heart, although as we see the heart does go slightly towards the left. So lateral chest injuries are sometimes, well, still serious of course, but they can be less serious, where the central chest injuries can be immediately life-threatening because of the heart and the major blood vessels, and penetrating injuries there can result in exsanguinating hemorrhage and clearly a potentially fatal condition in pretty short order. Now going down to the abdominal cavity. So the top right of the abdominal cavity in this area here we have the liver. So the liver is top right, and the liver is just underneath your right costal margin, which is just there. So that's your liver there. And underneath the left costal margin just there, on this side, we have the spleen. So it's liver and spleen. Kidneys, of course, at the back. And the colon goes from here, up here in the ascending colon, transverse colon, descending colon, then it goes back through the sigmoid colon to the rectum. So this is the abdominal cavity here. And then further down here, as we see, we have the pelvic cavity. Now in females, of course, this contains the ovaries and the fallopian tubes, what we now call the uterine tubes. It's going to contain the uterus and the vagina, the bladder as well, of course. In men, the sperm comes from the testes, but it comes up into the pelvic cavity to mix with the secretions from the prostate gland. So we have the pelvic cavity there, as we said, defined by the bones of the pelvic rim. So they're the main body cavities: the craniovertebral, the back, the dorsal body cavities, the thorax being divided into the pulmonary, pericardial cavity, although the pericardial cavity is part of the mediastinum, the abdominal cavity with these major organs and digestive organs in, and the pelvic cavity with the bladder and reproductive organs in. Very important for protection. So obviously we have the bones of the skull and the vertebrae protecting the neurological structures, but then we've got the ribs and the intercostal muscles, and actually the ribs and the intercostal muscles actually protect the top part of the liver and the kidneys to some extent as well. Also the spleen here. We have the vertebrae at the back, and we have firm muscles over the top of the abdominal cavity as well, protecting the organs of the abdominal cavity. So they're the main structures. That's the first part of this video. Now, in the next part, what I want to do is look at the membranes which are associated with the organs in these cavities. So just to whet your appetite, we're going to have the meninges surrounding the brain and the spinal cord, very important for meningitis. We're going to have the pleural membrane surrounding the lungs. We've already noted the pericardial membrane surrounding the heart. And in the abdominal cavity, we're going to, and indeed in the pelvic cavity to some extent, we're going to have the peritoneal membranes, which of course become inflamed in peritonitis, for example. So tune in for the next video for that interesting next episode.